One of the overarching theme this Equity Week was the need for accurate data, the need for data that is accessible to both policy implementers and to policymakers and to other stakeholders.
Inequality, equity, access to resources, services is a big and enduring question. But the problem is that it's been stripped of data and evidence, and it's all happening based on people's whims and anecdotes and stories they tell each other. And I think what we're trying to do is really provide some real concrete big conversations that we have. Somebody said that there's so much information, but there's very little knowledge. And I think what we lack is the skill to turn the information into some knowledge and a basis for action. We are not the same people, that's for sure. The counties that look very different from the others. And yet we have the same geographic boundary, we hold the same passports, we vote in the same elections, but the outcomes of that political process has not created equitable access to goods and services. So there's a deep basis for difference that we see across the county. And I think this is what the data is showing. The problem is that these things have not informed the political conversation. So the politics is on other things. The people who should be complaining and kicking are kicking for different reasons. They're not kicking around they're not asking, why do our mothers have to die just because they wanted to have a child? They're not asking questions like, why do kids drop out of school at numbers that are atrocious? Those are not the questions that are informing the political process. So what we also expect to do with data is to drive the political conversation to something that is more meaningful to Kenyans.
The role of data is to expose the needs and the disparities. What we do with that data, so that data is not an end in itself, So data is basically, it's just an input that helps us to see the need, the problem, and that's why, for instance, we use numbers to show, to discuss issues of what interventions should have in terms of poverty levels and all that. That's what data does. It simply exposes the disparities, it exposes the needs, but it also exposes areas of coverage, so that it shows us that a certain area has immunization cover of 90%, but a certain area has got immunization cover of 20%. So that's one. But also data does something more, is that by disaggregating that data to very small, even to the level of homes, then you are able to tell whether the problem is actually across board. Because, for instance, you could go to a certain county and county indicators on a certain aspect of health, let me use immunization because I've used it before, is very good. But then if you go further deep within that county, you actually realize there are certain disparities between wards. Certain wards are very high, certain wards are very low, because many times the number you get is the average. But then even when you go to those wards, you might actually find that between different home states, you have actually differentiation, because maybe they have certain cultural beliefs that they subscribe to, and therefore that's the role of data. Data exposes, but then also there's something we call longitudinal kind of tracking. So basically what you're saying is that we check in 2010, how was the situation? Then we come and check again in 2011, how is the situation? 2012. So over time, data shows us over time whether the problem is increasing or is decreasing. And that then helps us to inform our interventions. So in a way also it helps us in terms of monitoring whether we are making progress and progress in what direction.
If the county government is willing to change the inequalities within the county, then it's important that it appreciates different health indicators and how these are varied across the county subunits.
So in Baringo County, we have 6 sub-counties. So at the northern part of Baringo County, we have Tiaty sub-county, which is the least developed, as marked by red. But again, when it approach urban centers, there is Chemolingot, which is quite developed in terms of road infrastructure. But again, why we chose to mark the whole of the sub-county as underdeveloped is because of issues of access to water and healthcare. Then the next sub-county is Baringo North, where towards the headquarter, Cabernet and the surrounding wards, it's developed. But then at the borders of Tiaty, at the borders of Baringo South, it's quite underdeveloped. Then we have some, also a big chunk of the sub-county being fairly developed. Then at the extreme end, Eldama Ravine, just to portray the inequality, Eldama Ravine is fairly, most of the sub-county is developed with good road infrastructure, access to water, with some wards even having up to 85% access to water as per the last KNBS survey. Mogotio has a mixture that is towards Nakuru is fairly developed. At the center, where we have Mogotio town, it is developed, while at the borders of Baringo South, and of course the other side towards Nakuru, it is less developed. Then Baringo South, Baringo South at the center, we have Marigat and the surrounding irrigation schemes. They make the place quite developed, but towards the border of Tiaty and Mogotio, it's less developed.
Now, the discussion is often around how unequal counties are. You compare Migori to Murang'a, Elgeyo Marakwet to Baringo. That discussion is very common. But I want to tell you today that the inequalities that exist among wards are actually worse. Katilia ward, somewhere in Turkana, has a poverty rate of 99%. It basically means every 100 people you meet in that ward, 99 of them are poor. Probably that other one person is just slightly above the poverty line. In Nairobi, there's a ward called Lower Savannah. Lower Savannah has a poverty rate of only 3%. So the inequalities that exist among the wards, even within the counties, are actually way wider than the poverty that you even have among our counties.
There's a sub-county in Kiambu that has worse child and maternal outcomes than the average in Turkana. Now the question is why? So you'll be sitting around here and you're thinking the central Kenya is all glory and that. No. There are serious problems and inequalities within the counties. And I think what we want to do is how do we get to the sub-county level and then get the conversation around equalization, the same conversation we're having at the national level around equitable sharing of resources should go to the counties, okay? So that MCAs are now asking the same questions that senators ought to be asking about distribution of the national cake.
So data only sharpens the kinds of policies that we'll come up with, the kinds of laws that we'll come up with. So data plays a key role in understanding the extent of inequalities.
We have implemented free primary education since Kibaki's time. Many parts of the country, you'll see the numbers have gone up. Every cohort of class 1 is, this time we hit 1 million for the first time. 1 million kids start class 8. But if you look at the enrollment, 8 years ago, for this cohort that just finished, it is not 1 million. It's probably about 1.3, 1.5. Where are the other kids? Now you want to start tracing these kids. Not all of them live in Kiambu. They're in Turkana, they're in Marsabit. So you're looking at number of kids who are out of school who started, who enrolled, but did not complete. Tuaweza has done a lot of work on numeracy and literacy tests across the country. They tell us that there's a correlation between numeracy and literacy between grades 1 and 3 and the level of a mother's education. And this has been consistently demonstrated over the time that Tuaweza has collected this data. So if we're implementing free primary education, that policy must be bundled with adult literacy classes for the mothers so that they support the kids to learn. So it is this differential understanding of what you need so that policy is effective.
So if we say that we have vast inequalities in access to health in the country, which we do, and we say that one of the primary mechanisms for addressing these inequalities is investing in health facilities, yet we have no data about how much it actually costs to run these facilities and how much money we're actually spending on these facilities, then it is very unlikely that we are going to be able to use this mechanism to solve this problem.
The initial phase is just to show a picture at a glance of what happens. But if you look at vaccination rates, you can see that it is really not so, there aren't very red areas. It means that, you know, we have done quite well in our vaccination campaigns. And many of our countries would either be not so, unless now you go to places like West Pokot, and probably that's a reason, there's probably a reason why is it that West Pokot has very low vaccination rates. And so if I was in the planning and I wanted to do immunization campaigns, I would probably begin to look at these areas which seem to be apart from the rest in terms of their outlook of these variables.
I want to speak a little bit more on what we have started speaking about, which is the sector of health and how can we tell inequalities and how can we deal with them and how we're dealing with them. Let's look at the pre-devolution situation. Three things. At the time of devolution, there were certain inequalities, and we're going to look at three. We see that there was unequal spending. There was obviously an equal number of health workers. And when we look at the distribution of county residents per health workers was also unequal. And we also look at the skill mix at the beginning of devolution. Then now we look at post-devolution. We got from 7 counties, and what we see is an increase in health workers, a positive change in health workers, but it's not similar. So you see counties like Samburu, there's 13% increase in health workers, and counties like Turkana, for those 10 categories, 232 increase in health workers. So it's a significant increase. But the trick is just look at the numbers. Still, they don't have as many health workers as they would need for the county, okay? But there is positive change.
This work was conducted by Edwin, so that is my supervisor, and colleagues. So they looked at the 2 known measures of financial protection. So they looked at impoverishment and looked at incidence of catastrophic healthcare payments. And they used the Household Health Expenditure and Utilization Survey 2013 and found generally, you can access the paper, that about 4.5% incidence of catastrophic health expenditures as of 2013. Well, this is good news in a way because 2007 had found 14% incidence of catastrophe. So you can say that the incidence of catastrophe has reduced over the past 5 years. Whether to attribute that to the interventions that have been conducted in that period is a different story. This is a description only. And if we consider indirect costs, transport, and related costs to access these facilities, the catastrophe incidence comes to about 6%.
Now, in 2016-2017, in the national budget, the government, for some good reason, decided that they were going to present the development budget, not so much in terms of the monies for development going to the departments within ministries, but they decided that they were actually going to list each individual project under the departments and ministries at the national level. Of course, it's quite a huge number of projects, but we decided to focus on the State Department for Infrastructure and the State Department for Water Services. For roads, and let me start with roads at the top, So one measure is simply to look at the unpaved roads, because if you have an unpaved road, we need to pave it. That seems like a direct investment we have to make. So we look at, of all the unpaved roads in the country, what share does each of the county actually account for? So that will give us a measure of the need that exists in terms of roads that needs to be paved. Now, the top 10 counties in terms of the shares of unpaved roads. So when we look at the top 10 counties, they accounted for about 40% of all the unpaved roads in this country. However, when it comes now to their allocation, they only allocated 12% of that capital budget. Now, for the top 10 counties in terms of paved roads, the average is actually 1 kilometer of paved road for every 8 kilometers square of land. So when you compare that to the average, that is pretty good. But they were allocated 55% of the budget. So guys with very good access are getting over half of the budget for 10 counties. Now, the bottom 10, the average is 6,814. Again, when you compare that to the average, you can see that that is actually quite bad. But how much do we allocate them? Just 10% of the budget.
And we saw from Equity Week, people demanding that we need to have access to information. It is impossible for us to expect people to comment on policy issues when they are not informed.
So if you look at the population data we use, if you look at most of the data that we have around access to certain services, it's really data from the census in 2009. Once in a while you bump into data from 2014, but we are making decisions about 2017 and 2018. So having a way that that data is also updated where available is also a challenge that we have to face and see how to sort it out.
The biggest problem that I have, and I think it is a common problem for all of us, is the good quality data. Because a lot of this data we used the statistical abstracts, the economic surveys, and largely we used the 2009 census data, and you know that is really outdated. And so we are very excited. We are getting ready so that the moment they do the new census, we will have a place we just plug it in and play.
One thing, and I have spoken to this, is how do we get data on this? I'm glad he said his data is from the 2009 census, but it's now 4 years into devolution. We need to update our data. And if we're going to get data from counties, does that mean I go on a Kenya road trip and then go to every county and say, I need to know how many health workers you have because this is important for policy? So there are huge data challenges, and I thought the place to get this data was the Council of Governors, but I requested for data. This has been since June last year, but nothing from them. And then obviously the Ministry of Health was like, we don't have current data, this is what we gave them. They are doing their own things, okay? So, and then the information system doesn't help because it's voluntary, so it doesn't mean it's the most updated or the most accurate data.
But there is need for us to get a bit proactive in making sure that there is data that helps us. It's not just collecting data randomly. Is to say, I am a county, I need to understand the health status in my county, because the next time I'm preparing my county integrated development plan on the next budget, I need to be a bit more specific. And then, you know, it also makes it easy for the government to explain to people why they are making the decisions they are making. So it doesn't come out as we are spending money in Ward X because that's where the governor comes from. But it's more of we are spending money in Ward X because Ward X has the worst health indicators and we need to sort that out. And the fact that people can see that, then you also manage expectations.
In a devolved system, somebody must take responsibility for collecting data from the devolved units, putting it together, and making it accessible. It is the only way for the public to engage. It is the only way for Parliament to exercise oversight. It is the only way for national policymakers to make intelligent decisions. The truth is that today, if you want data from the counties, you have to go to each county and get it. Yes, it is the county's responsibility to make information available to the public. But the truth is that anybody who wants to know sitting not just in Nairobi, but sitting in Kwale, sitting in Turkana, sitting in Kisumu, what their neighbors are doing, what the other counties in the region are doing, how Kisumu compares to Mombasa, cannot be expected to go to each individual county to request for information. This is simply not feasible. And therefore, if we expect devolution to work again, what is the theory? The theory behind the decentralization of resources is that counties or subnational units will compete with each other to provide better services. They will learn from each other. What are other counties doing? Why aren't we doing that? And the public will also ask, but Kisumu is doing this, but Turkana is doing this, but Makueni is doing this. But that will not happen if the data is not available in a centralized place for us all to see what the different units are doing.
We saw that some organizations are trying to resolve this data challenge by providing portals that give us refined data and data that can be easily used by those who need to make decisions on certain policy issues.
So what the Spotlight on Kenya is, it's an online data platform where we have socioeconomic indicators that are disaggregated up to the subnational level for Kenya, that is counties. And at the same time, we visualize as well the resource flowing into these counties. So how much they're getting from the national government, how much they're raising internally, how much they're getting from the donor community. And we also allow the user to experience how the county governments are using these resources. So what sectors are they prioritizing? And the beauty about this is when you have the socioeconomic indicators alongside resourcing, you can easily see whether they are prioritizing the critical areas that they need to. So for example, if your health indicators are not doing so well, then you would expect that at the monetary level, you'd be prioritizing health development at the county level if you're a government. So if you're a citizen, you would want to know these things. So when you're engaging with your government official, you'd have something to talk. You'd be more informed in how you engage around development.
So this is our first portal. This is the first one that we are having, and this is, you can go to different sections and you can be able to get what you're looking for. Yeah, but the part that particularly concerns this discussion is a part here where we are talking about the various parameters that we thought would be reasonable for determining the outcomes of health. But as you can see that we are not just in health, we are looking at very many things at the same time. We are looking at infrastructure, education outcomes, incomes, health and sanitation. And under health, we have looked at so many things. We have looked at mobility, nutrition, access to water, sanitation, and even things like reproductive health. So we have clustered several parameters that we are looking at in this frame. And under of this, we have maternal mortalities, deliveries in hospitals, child mortalities, incidences of diarrhea, HIV prevalence, vaccination rates, because we thought then these would be very useful parameters in describing health outcomes. And of course, we have highlights, we have definitions. If you highlight there, you will be able to tell what that means.
Our Spotlight on Kenya, it is an example on how we can use similar initiatives to steer or to help with evidence-based decision making. So we believe that with data, we can disaggregate data in terms of gender, geography, income, location, and disability. These can come together to show us where the poor people are, where there are the parts of the country where the inequality is so much, the marginalized part of the country. So this data can be used in in trying to address the gap in inequality that exists there.
So data, like I said, is the first step towards resolving inequalities. Once we know what our differences are accurately, then the kind of policies that we put in place, the kind of law that we put in place will appreciate this fact, and we will be able to improve our development strategy.